Welcome to Talking Treatment, the podcast that features healthcare experts, industry leaders, and treatment center providers from around the country, presented by AZZLY. I'm Tom Patton, and on this episode, I'm talking with Joyce Wagner, the COO of AZZLY and the Director of Revenue Cycle Management Services. Welcome, Joyce.
Glad to be here and happy that you asked.
Can you describe what makes AZZLY's RCM billings and claims services unique?
Yes, I think the thing that sets us apart from our competitors is our ability to automate the claims processes. This results in setting up modules, billing modules, that allow a user to bill by appointment types, notes, providers, location, level of care, unique payer situations, fee schedules, flat fees, government grants, billing for corporations, billing for Veterans Affairs and other government agencies and courts, and have their claims go through with a very high first-time pass rate.
How have business rules evolved when it comes to processing claims?
Well, over the past few years, the payers have changed the services that they provided for. And then obviously, more than a year ago, we were faced with a pandemic. And life as we knew it changed tremendously, especially for those that are in our space that we serve. Telehealth, which was on a limited basis before the pandemic, became a way of life. Our clients overnight had to learn to offer service to mental health and substance abuse patients through telehealth. We evolved our system to accommodate those services and allow their billers to appropriately bill and be promptly paid for them.
If a client has internal codes that they currently use, can the AZZLY system integrate those codes into their billing process, or do they have to reinvent the wheel?
No, our system is extremely flexible, and we constantly have clients that join us that have third-party funding services that they bill. They use what we call internal codes. We set them up in the system in the same format that we set up the CPT and ICPIC codes. We allow them to create claims or create financial spreadsheets that they can send to these situations, whoever they are, and be reimbursed for their services.
Joyce, who's an ideal customer for the AZZLY RCM services?
An ideal customer would be those with a very high accounts receivable, those who are frustrated because their claims processing is so far behind, or they aren't in control of their accounts receivable because their billing is being outsourced and they're failing to receive the reports that they need to know where they are. That is the client that is usually attracted to AZZLY.
What then are some of the unique features that make the biller's job easier?
Usually when a biller joins us, they have all these manual processes and spreadsheets that they use in order to not only process their claims, but track their accounts receivable and do their collections. All of the billing modules within AZZLY are automated. They are all one click away from receiving a report for a biller to know where they are. And they're also a click away from being able to create claims for an entire day. With this automated process, billers who are used to manually creating and sending 100 or 200 claims a day can now process those same claims in the matter of under an hour. And so they then become reviewers instead of doers. This allows them to repurpose their day and spend more time on the other billing processes.
Is automating that claim system particularly important?
It's extremely important. It is the single reason that expansion of the services you provide to the community into other communities, or expanding your repertoire of services you provide, can be handled without having to increase your personnel staff.
What about facilities that have multiple locations, either in the same city or statewide or even in a broader geographic area? How does AZZLY integrate all of those different locations?
Because we're in the cloud, your businesses can be all over the United States, and the system can track those various locations and services that you provide. And you can have a biller in one state billing for all the rest of the states because they have access to all of the data that they need to create and file claims.
It sounds to me like in this time when more and more companies are having people working from home, this could be a very efficient way for them to do business.
Absolutely. We find that the majority of billing staff is often located working from their home and not going into the facilities. And it was due in large to the pandemic. This also allows a client to go out and expand where they hire their billers, and allows them to pick a biller that maybe has a better suiting to the model that they provide.
Now, I understand that you've created some exception reports that are extremely helpful. Joyce, can you talk a little bit about that and why they're important?
Yes, we took a look at all of the various reports that are out there in our space and just quickly discovered that what we need to do for our clients, especially in the billing component, is tell them what is wrong, not everything that is right. So that when a biller is working throughout the day, they're able to look at the reports that tell them what need to be done, not what has been done. And also exception reports provided for the clinical and medical staff to alert them when notes are not signed, so that they know we've got billing that needs to go out. We need to get these encounters and notes completed and signed by the provider. We also provide them exception reports that tell them that claims have not been created, but there have been some checked-in appointments. And so the biller can quickly look and see what was the thing that caused the claim not to create. Either the note wasn't signed or some of the reasons behind why we don't have a claim created.
And those exception reports are part of the basic package?
Yes, they are. All of our reports are included with the RCM billing module.
There's a move now towards MCO or managed care organizations. Can AZZLY handle that kind of special capitation billing?
Yes, we have multiple providers that use AZZLY both on the clinical and medical side, clinical and medical, as well as the billing side, and they have our capitation models with the payers. They get paid up front and have to do the equivalent of encounter reporting, and we are able to process those types of claims for them.
Joyce, without being particularly specific and naming names, can you share any real use case examples that AZZLY's customers have experienced using your RCM service?
Absolutely. We have all types of billers that join AZZLY. We have everything from the experienced to the novice. We had one individual that joined us that had never billed before. She was very smart, had good mathematical skills, but she knew nothing about creating and processing claims. We trained her, taught her how to manually create claims so that she learned the process of claims. And within a month, she was doing automated claims and had collected $300,000 in back billing for this client of ours.
So what kind of a learning curve is there to use the service?
It depends on the skill set of the biller. We offer a variety of different trainings. We do groups, we do individual training, and we don't turn them loose until they're proficient in AZZLY. In general, we find that an experienced biller within less than 3 hours will be very proficient in AZZLY. A new biller may take up to 10 hours to do the billing, but it is very simple. There's no degree of difficulty in doing this. Everything is one click. It is thought through and laid out in a very simple process that most individuals have no trouble learning.
Is that training something you generally offer in-house or in the field, or how do you conduct the training?
Our training is all done on the internet through Zoom meetings or GoToMeetings, and we've been very successful with that. We used to go out and do on-site training, but we really prefer that the billers get into a room where they can 100% devote the hour or two that we set aside to do these training sessions without any interruptions. When we go there, we tend to find out that people are constantly coming into the room. So we've had a much higher success rate with our internet training.
Joyce, when I talk with physician friends, they often mention that they have to keep a person or multiple people on staff specifically to handle insurance claims. Does AZZLY streamline that process?
Absolutely. When a customer joins us and they become a client, we have meetings with them and we go through and learn what services do you provide to your patients. As part of this, we then develop a charge master, and we set up the business rules based upon appointment types, notes, providers, locations, billing by level of care, and set up all of the rules to automate that when appointments are checked in or notes are done, those code sets are attached to those modules. And the human is cut out of having to create the claim. The system creates the claim.
So that's going to positively affect the bottom line for those physicians' offices and make things a lot more efficient.
It allows them to repurpose hours of the day with their billers for other tasks that they may have. We find out that the follow-up on AR as well as other authorizations, etc., is greatly streamlined because of this automation process.
I guess a lot of people are trying to think now, Joyce, how much does the service cost?
The service is very reasonably priced. We offer, it includes transitional billing. It includes all of the services that we provide on the RCM side, and our clients can pick and choose what they want to do. In-house, what they want us to do, or what modules they want to incorporate into that claims process.
Finally, Joyce, what friendly advice can you offer an organization that wants to better manage their payment reimbursements? You mentioned the transitional billing. You might want to expand on that just a little bit as well.
The transitional billing allows us to do their billing for them or with their billers for a period of time until their revenue stream is automated and they are going to know on a weekly basis what their expectation of money coming into their bank is going to be. We go so far as to interact with the Medicaids throughout the country, the MCOs that do the Medicaid billing, and they will know what day of the week they have to have their claims in and what time they have to be in by to get a check the following week for the services they billed the week before.
And AZZLY will do all that in an automated fashion, and they'll be on about their business.
Correct.
Well, Joyce, that is all the time we have for this edition of Talking Treatment. Thank you so much again for joining me.
Thank you.
Joyce Wagner is the COO of AZZLY and the Director of Revenue Cycle Management Services. Talking Treatment is produced by Broadreach Communications and AZZLY. AZZLY offers an all-in-one solution for behavioral health care and addiction treatment providers. Visit AZZLY.com, that's AZZLY.com, to schedule a free consultation with an AZZLY expert today. And be sure to subscribe so you don't miss an episode of Talking Treatment. I'm Tom Patton. Thanks for listening.